when the cure becomes the risk. Imagine discovering that a drug you've been taking for years to treat allergies, anxiety, or acid reflux might be quietly contributing to the decline of your brain. For millions around the world, this unsettling scenario is becoming all too real. Recent studies have identified a disturbing link between certain widely prescribed medications and an increased risk of developing neurodegenerative conditions like Parkinson's and Alzheimer's. These aren't obscure or experimental treatments. They're found in everyday medicine cabinets, often considered safe. One such case involves diphenhydramine, an over-the-counter antihistamine commonly used for allergies and sleep. Research has associated long-term use of anticholinergics like diphenhydramine with a significantly higher risk of dementia. The implications are stark. What we take to heal one part of the body might be damaging another in silence. A few years ago, an older woman started forgetting simple things, where she parked, what she just ate. We brushed it off as stress. Later, we found out she had been taking multiple medications on this list. Her story pushed me to dig deeper and share this video with you. If you're finding this eye-opening, hit like, subscribe, and share it with someone who needs this knowledge. It might change a life. Before diving into how specific medications might contribute to these diseases, it's essential to understand what they truly are. Parkinson's disease is a progressive neurological disorder that primarily affects movement. It begins when neurons in a region of the brain called the substantia nigra begin to die, reducing dopamine production, a neurotransmitter critical for motor control. Symptoms often start subtly with hand tremors or muscle stiffness and gradually evolve into more severe issues like impaired speech and difficulty swallowing. Alzheimer's, on the other hand, is the most common form of dementia. It disrupts memory, thinking, and behavior due to the buildup of beta-amyloid plaques and tau tangles in the brain, which interfere with neural communication. Early signs include forgetfulness and confusion, eventually progressing to profound cognitive decline. These diseases don't develop overnight, but rather through years, sometimes decades, of silent neurological damage. And unfortunately, certain medications may accelerate this process. It's unsettling to think that some of the very medications intended to relieve symptoms or manage chronic conditions might silently increase the risk of neurodegenerative diseases. Yet, research has repeatedly shown a strong link between certain drug classes and cognitive decline. Among the most concerning are anticholinergics, benzodiazepines, and antipsychotics. Medications widely prescribed for issues ranging from allergies to insomnia, anxiety, and psychosis. These drugs can interfere with crucial neurotransmitters, slow brain metabolism, or even trigger symptoms that closely resemble early Parkinson's or Alzheimer's. The issue is not just in their chemical composition, but in how they interact with the aging brain, often compounding risks in older adults. For example, long-term use of anticholinergics like diphenhydramine, commonly found in Benadryl, has been associated with measurable brain atrophy and memory loss. It's not about inciting fear, but rather empowering awareness, so people can make informed decisions alongside their doctors. Anticholinergics are among the most extensively studied drug classes when it comes to cognitive impairment. These medications work by blocking acetylcholine, a neurotransmitter essential for learning and memory. While they are effective for treating allergies, motion sickness, and even bladder issues, their long-term use, especially in older adults, has been linked to a significantly increased risk of dementia. This is particularly troubling because many of these drugs are available over the counter, making them easily accessible and frequently used without medical oversight. The danger lies in the cumulative effect. Consistent use over time gradually erodes memory and mental clarity, often without immediate symptoms. What's more, the brain changes associated with anticholinergic use resemble those seen in Alzheimer's patients. Reducing or replacing these medications with safer alternatives is a vital step in protecting cognitive health. Conversations with a healthcare provider can lead to better, brain-friendly choices that do not sacrifice symptom relief. Benzodiazepines, widely prescribed for anxiety, insomnia, and seizures, offer rapid relief, but at a hidden cost to the brain. These drugs enhance the effect of GABA, a neurotransmitter that calms neural activity, which is why they're so effective at reducing anxiety and promoting sleep. However, this same mechanism can dull cognitive function over time. Studies have consistently shown that prolonged use of benzodiazepines is associated with an elevated risk of Alzheimer's disease. This risk is particularly pronounced when the drugs are taken in high doses or for extended periods. One notable study published in the British Medical Journal found a strong correlation between long-term benzodiazepine use and the onset of dementia. What makes this issue even more critical is how often these medications are used without proper reevaluation. Patients and physicians must weigh the short-term relief against the potential long-term harm. Exploring non-pharmacological therapies like cognitive behavioral therapy or mindfulness practices may offer safer paths to emotional well-being without compromising brain health. Antipsychotics, such as haloperidol and risperidone, are essential for managing severe mental health conditions like schizophrenia and bipolar disorder. Yet, their neurological side effects raise serious concerns, especially regarding long-term cognitive impact. These drugs often act on dopamine pathways, which are crucial not only for mood and perception, but also for motor control. As a result, prolonged use can induce Parkinson-like symptoms, such as tremors and muscle rigidity. Alarmingly, research published in the Journal of Clinical Psychiatry indicates a significant association between the chronic use of antipsychotics and the development of Parkinson's disease. For patients already vulnerable to cognitive decline, this adds another layer of risk. While antipsychotics are sometimes necessary, especially in acute psychiatric crises, clinicians must vigilantly assess ongoing use, particularly in older adults. There's a growing push to explore safer alternatives, such as psychosocial therapies or carefully titrated doses, to minimize these cognitive repercussions. Proton pump inhibitors, PPIs, like omeprazole and lansoprazole, are commonly prescribed to treat acid reflux and stomach ulcers. While effective for gastrointestinal relief, long-term use has been linked to troubling cognitive consequences. PPIs can interfere with the absorption of key nutrients, such as vitamin B12 and magnesium, both vital for neurological function. Deficiencies in these areas may contribute to memory impairment and increased risk of dementia. A study published in JAMA Neurology found that individuals who used PPIs for extended periods had a significantly higher chance of developing dementia compared to non-users. The mechanisms behind this association are still being explored, but some researchers suggest that reduced neuroprotective nutrient levels, combined with chronic inflammation, may accelerate neurodegeneration. Despite these concerns, PPIs remain among the most overprescribed medications. Patients and doctors alike must weigh the benefits against the risks, especially when safer, non-pharmacological interventions like dietary changes can offer comparable relief. Tricyclic antidepressants, TCAs, such as amitriptyline and nortriptyline, were once a cornerstone in the treatment of depression and anxiety. Though largely replaced today by newer, safer options like SSRIs, TCAs are still prescribed for chronic pain, migraines, and sleep disorders. However, their strong anticholinergic effects raise serious concerns. These medications block acetylcholine, a neurotransmitter critical for memory and learning. Over time, this interference can lead to significant cognitive decline. A pivotal study in the American Journal of Psychiatry reported a marked increase in dementia risk among long-term TCA users. The impact is particularly pronounced in older adults, whose brains are already more vulnerable to neurodegeneration. As a result, many medical guidelines now recommend minimizing the use of TCAs in elderly populations. Patients should not stop taking these medications abruptly, but rather consult with a physician about safer alternatives that preserve mental clarity while still addressing their symptoms. Antiepileptic drugs, EDs, such as carbamazepine and phenytoin, are essential for managing epilepsy and certain mood disorders. Yet, their effects on brain function go far beyond seizure control. These medications often dampen overall neural activity, which can result in slowed thinking, memory lapses, and attention difficulties. Research published in neurology has linked prolonged use of some AEDs to accelerated cognitive decline, particularly in older adults. The concern is not just limited to the medication's sedative effects, but also includes their long-term influence on brain structure and connectivity. Moreover, individuals with epilepsy already face a higher risk of developing dementia, and certain AEDs may compound this risk. As a result, doctors are increasingly cautious in choosing the type and dosage of antiepileptic drugs, especially when treating conditions like bipolar disorder or chronic pain. Regular cognitive assessments are recommended for long-term users to ensure that neurological health is being preserved alongside symptom control. Dopamine agonists like pramipexole and ropinirole are commonly prescribed to alleviate symptoms of Parkinson's disease by mimicking dopamine in the brain. While these drugs can improve motor function and quality of life, they are not without risks. Some patients experience side effects such as hallucinations, impulsive behaviors, and worsening of motor complications over time. There's ongoing debate about whether these medications might inadvertently contribute to neurological stress or even accelerate certain aspects of neurodegeneration in some cases. This paradox highlights the delicate balance in managing Parkinson's, treating symptoms while avoiding further brain damage. Physicians closely monitor patients on dopamine agonists to mitigate these risks, often adjusting treatment plans as the disease progresses. Understanding the dual nature of these drugs underscores the importance of personalized medicine in neurodegenerative disorders. Oral contraceptives, such as those containing estradiol and norethisterone, are widely used for birth control and menstrual regulation. However, emerging research suggests that long-term use of these hormones might influence cognitive function in subtle ways. Some studies indicate possible associations between extended contraceptive use and changes in memory, attention, or mood, which could potentially increase the risk of cognitive decline later in life. The mechanisms remain unclear, but may involve hormonal effects on brain chemistry and structure. It's important to note that these findings are not conclusive, and many women use these medications safely without noticeable cognitive effects. Nevertheless, this area calls for further investigation and encourages patients and healthcare providers to weigh benefits and risks carefully, especially in those with a family history of neurodegenerative diseases. Stimulants like methylphenidate, commonly prescribed for ADHD, improve focus and attention but may have long-term neurological implications. While these medications, such as Ritalin and Concerta, are effective for managing symptoms, prolonged use has raised concerns about potential cognitive side effects. Research suggests that chronic stimulant use could alter brain function, potentially affecting memory and increasing vulnerability to neurodegenerative conditions like dementia. However, the evidence remains mixed, and for many patients, the benefits outweigh the risks. Still, this highlights the need for ongoing monitoring and open conversations with healthcare providers about the duration and dosage of stimulant medications to ensure cognitive health remains a priority. Corticosteroids, such as prednisone, are powerful anti-inflammatory drugs used to treat autoimmune and inflammatory conditions. Despite their effectiveness, long-term use of corticosteroids has been linked to memory problems and cognitive decline. Studies, including one published in the Journal of Alzheimer's Disease, indicate that extended corticosteroid therapy may increase the risk of dementia by impacting brain function and structure. These drugs can alter the balance of brain chemicals and increase vulnerability to neurodegeneration. Patients taking corticosteroids should work closely with their doctors to weigh the benefits against potential cognitive risks, exploring alternative therapies or strategies to minimize exposure when possible. Recognizing the early signs of Parkinson's and Alzheimer's can be a game changer in managing these diseases. Symptoms like tremors, rigidity, memory loss, and confusion should never be ignored. Early diagnosis opens the door to treatments that can slow progression and improve quality of life. Beyond medical management, adopting healthy lifestyle habits is essential. Regular physical exercise, a balanced diet rich in antioxidants and omega-3 fatty acids, cognitive stimulation, quality sleep, stress management, social engagement, and routine medical checkups collectively build a strong defense for your brain. Remember, staying informed and proactive is the best way to protect your cognitive health. If you found this video valuable, don't forget to like, subscribe, and share it with someone who might benefit. Your support helps us bring more life-changing information to you.